Hi everybody, I'm Dr. Tim Chrisman here to talk about another very important nutritional topic. What if you could live life without fatigue, muscle weakness, weight gain, weight loss resistance, depression or anxiety, puffy or dry skin, difficulty concentrating, loss of hair, constipation, and difficulty regulating your internal temperature? This is just a short list of common symptoms relative to iodine deficiency. You may know them better as hypothyroid symptoms because hypothyroidism is synonymous with low iodine. Now, it's possible that you may have one or several of these symptoms periodically. Obviously, there are several things that could cause that, but I'm going to at least present a couple of points in this video that might motivate you to look into your iodine status or consider supplementation and testing. In the clinical world of nutrition practice, it's easy to get sidetracked by fancy new formulas. We have so many diverse options and information at our fingertips, and the supplement world is subject to a million different fads. But in my nutrition practice with patients, I'm always trying to find the lowest common denominator, the antecedent to the cause of a problem, so to speak. So right now we're going to go back to basics and talk about iodine. In nutrition, it's always a balancing act between toxicity and deficiency. If you don't absorb enough, you'll have a deficiency. If you don't eliminate enough, or if you take too much of something, you might get a toxicity. And both issues lead to health conditions. And iodine, which is a nutrient that I believe is commonly deficient in America, is one of those nutrients that needs a little bit of care and caution. Some people can take larger doses than others for a while without having any difficulties, but it can stimulate a toxic or autoimmune response in people who have a sensitivity. And you can get a goiter, which is a swelling in the thyroid and the neck from taking too much iodine as well as not taking enough. The majority of people out there can probably start today and take normal or small doses of iodine with no negative effect. But in an abundance of caution, it bears noting that more iodine is not always better, and it's important to ascertain with objective means if you should use it or not. Several nuanced scenarios can present. Some people are deficient and don't react to supplementation, but others have pre-existing inflammatory conditions, infections, autoimmune issues that are also deficient, but they're sensitive to it and have toxic reactions. If you fit into that latter category, you probably know who you are already, but if you don't, you'd be well advised to handle this with care and some assistance from a nutritionist or a doctor who can help determine doses and troubleshoot eventual problems. I'm hoping to encourage you to look into this for yourself because iodine has implications into many different health conditions. Just like vitamin D and omega-3 fatty acids, this is a foundational nutrient. It's an essential trace mineral. Without these things, you might just end up being a miserable lump on the couch. But iodine is one of many minerals we need, but it's taken for granted because for decades we've assumed that it's not a problem in America. There are some governmental control measures and laws and different things to ensure that it's supplied in the American diet, such as iodized table salt, and even our cows are fed iodine in their rations. So we get it in our milk and beef, and it's also in eggs and other plant-based foods as well. But if you're a cardiovascular patient or if you have other health conditions and you've been scared off of salt and milk and beef and eggs, it could be a problem. Also, there's a certain class of vegetables called cruciferous vegetables in the brassica family, such as kale, Brussels sprouts, cabbage, broccoli, and cauliflower. These all have goitrogenic effects when eaten raw in high quantities. And if you're one to have the kale shake every day because you think it's healthy, you may reconsider if your iodine levels are low or if you want to preserve the iodine in your system. Certain parts of the U.S. have iodine-poor soils, and not many of us eat a ton of seafood or kelp with extra iodine. If you know anything at all about it, you know it's impossible to make thyroid hormone if you don't have iodine, but it's important for a lot of other organs as well. Once upon a time, it was thought the thyroid was the only gland that really had receptors for iodine or utilized it, but we now know that all tissues, and especially breast, ovaries, prostate, and testicular tissues can take up iodine as well. So it plays a larger role than just the production of thyroid hormone. And it has gotten some bad press over the years for several nuanced and complicated reasons. Autoimmune diseases like Hashimoto's thyroiditis and Graves' disease, both related to the thyroid, predispose people for sensitivity to iodine. On the flip side, some people who are severely deficient but otherwise healthy react because larger doses of supplemental iodine can cause a detox reaction where iodine literally pushes out other halide elements such as bromine and fluorine and chlorine. Those are used in chemicals and are everywhere in our environment and in our food. In the body, they compete with iodine. This detoxification isn't a huge problem because detox reactions are evidence that something is really working. As long as it's not too severe or causing an inflammatory reaction, and you're not going too hard or too fast with iodine, things should come out better in the end. These other halide elements are all in the same class on the periodic table as iodine, and as such, they have similar chemical characteristics. If the body's presented with an overabundance of these less biologically friendly halides, while concurrently deficient in iodine, it will uptake whatever halide chemical presents and even put it into the thyroid hormone instead of iodine. Obviously, that's unhealthy thyroid hormone, and it's not going to act the same way in your body as the healthy thyroid hormone with iodine. In the U.S., we're considered to be an iodine-sufficient country. But one of the reasons I believe we have a bit of an epidemic of iodine deficiency is for some of the dietary reasons I mentioned earlier, and also because we put an enormous amount of chlorine and fluorine-based chemicals in our water supply. We used fluoride toothpaste and concentrated fluoride rinses at the dentist. Things like soft drinks, baked goods, and other industrial foods have bromine in them. There's also heavy use of chlorine and bromine in swimming pools and hot tubs. We can absorb these not only from ingesting them, but also through the skin from taking showers and baths and even inhaling the vapor of tap water. Even though most of us eat the food sources of iodine, there is a lot of competition for limited real estate in our bodies. Most of the people and processes using these chemicals will tell you that it's not a problem and our laws prevent us from getting too much and that they're within safe limits. I'm not convinced that the collective barrage, however, of these toxic elements isn't affecting us more than we think. These other chemicals can outcompete the iodine, and when they reach a certain point of toxicity, it can be really hard to supplement an amount of iodine that can accommodate for it. So there's that. And then another evidence of deficiency in our society is the widespread use of thyroid medications, like levothyroxine, which is almost always the top drug or one of 2 or 3 most prescribed drugs, with around 23 million Americans taking it. Iodine deficiency is synonymous with hypothyroidism. Levothyroxine, which you may know as Synthroid or other names, is given for hypothyroidism. And everybody has an aunt or a grandma or a mother or sister and sometimes a man in their life that takes this drug. If you put 2 and 2 together, that definitely puts a bright light on this potential for iodine deficiency. Deficiency is correlated not only to hypothyroidism, but also fibrocystic breast disease, breast cancer, benign prostatic hyperplasia, and even prostate cancer, which are all cell proliferative diseases. That means there's a factor of abnormal cell development or too many cells. Plus, there's a host of more minor symptoms related to deficiency, and we talked about a few of those at the beginning of the video. One important distinction I should mention is that there's a difference between cause and correlation. And if you've watched any of my other videos, or if you're a patient, you know that I talk about other known causes of disease and to consider, in addition to nutrient depletion, like infection, parasites, toxicity, stress, and nervous system interference. But in this correlation with the proliferation of cells, iodine actually inhibits abnormal cell development and encourages normal cell death, which we call apoptosis. It's actually a process where the cell's programmed to die normally. It can be protective from developing some of these conditions in the first place, but if they develop out of a deficiency of iodine, you may have difficulty supplementing larger doses after the fact to try and catch up or correct for it. It's much easier to maintain iodine sufficiency than to supplement after a severe lack during a health crisis. Attempting to get your levels up quickly with higher doses to fight that might backfire on you and create an even deeper crisis. So how do we troubleshoot some of these issues? Testing and caution with supplementation is really the key. We consider the whole clinical picture. Are other parts of your endocrine system struggling? Do you have other health conditions, or are you basically healthy? Are you female or male? And there is a difference when it comes to this nutrient because thyroid conditions are 10 times more likely in the female. And this is probably because they have a much more volatile and fluctuating hormonal system, and pregnancies and developing fetuses require larger amounts of iodine to prevent mental and developmental deficits. After a woman's had maybe 1, 2, or 3 kids, it's very likely she's going to be depleted of iodine. For healthy individuals with no sensitivity, supplementing with an upper limit of about 1,000 micrograms a day or 1 gram should not create toxicity. But sometimes we use significantly larger doses to get to a point of repletion quicker and then modulate the dose down once it's taken care of. That requires careful monitoring, as I've said, and communication between you and your doc. The solution's a bit more complicated for individuals with known conditions or allergy. They should still be able to supplement small doses, not always, without difficulty, but in my clinical experience, it should always be an individualized approach based on a complete clinical picture, as I said before. I've seen people react to taking just 1 capsule per day of kelp, which has as little as 250 micrograms of iodine. And then I've seen people take 12 milligram doses for several days and even weeks in a row with no difficulty at all. Again, if you're in deep waters with your health, testing before supplementing, then monitoring is the best practice. You could just say, I'm going to take small doses and just wait to get better ground, but you may find that can take forever, and you may never get to a therapeutic level of supplementing high enough to prevent or fix problems already in motion. One simple home test is the iodine patch test. Now, this is not the gold standard diagnostic test by any means, but you can do this all by yourself with an iodine tincture from almost any pharmacy. It's not a quantitative lab test, but more of a screening test to indicate your relative need to supplement or look further with more specific testing. But once you have the tincture, apply a 2-inch patch of iodine to soft skin on the inner thigh or on the upper arm, right in this area, and observe it for a period of 24 hours. If it disappears quickly within an hour or two, you're probably severely deficient. The assumption is that the need is proportional to the speed at which it disappears or is absorbed into your skin. Another such test, which is very similar in scope, is a zinc solution. If you put the zinc solution in your mouth and you can taste the zinc strongly, it kind of tastes like eggs or weird minerally flavor, you're probably deficient. If you can't taste it at all, your body probably needs zinc. But with the iodine patch test, if it's still visible after 24 hours, most likely your iodine levels are sufficient. And again, this is a screening test and shouldn't really be used to determine dose. It's not predictive of complications that may arise if you should start supplementing. But for a more precise measurement, you can do simple blood tests or urine tests to see where your levels are. But a very interesting test is from the lab called Doctor's Data. This test is called urine halides pre and post load test. This test uses a loading dose of iodine and tests 24-hour urine collection to evaluate iodine sufficiency and the presence of bromine and fluorine, which compete with iodine and block its uptake. The loading dose of iodine, which is a whopping 50 milligrams, and we usually talk about iodine in terms of micrograms or thousandths of a gram, this large dose forces iodine and the other halides out of the body into the urine through normal excretion. Then the urine collected over a 24-hour period is evaluated for relative deficiency and toxicity of these things. And this can help to determine if you need to detox or try to moderate the amount of stuff you're exposed to with fluoride and all that stuff in it. And it's also a good starting point for supplementation. Iodine is found in milk, eggs, seafood, and some fruits and vegetables. There's a lot of variability in all of that, which should be noted. Some eggs have around 25 micrograms of iodine, but others have more like 60. And some dairy products have more or less iodine in them as well, depending on how much the cow got in its diet. As I've said before, you always want to consider how a food was prepared, processed, or raised. and that can determine its nutrient value. But I'll reiterate here that avoiding iodized salt, milk, eggs, or iodine-containing foods due to allergies or health concerns can put you at risk of deficiency. And additionally, consuming large amounts of raw goitrogenic foods like kale and broccoli and Brussels sprouts can block iodine absorption, leading to thyroid swelling, and which is also called a goiter. Goiter is relatively common in the U.S. About 5% of people in our country currently have that, but it doesn't account for people who have it and haven't sought help or have subclinical issues where it's not yet noticeable. The RDA for iodine is 150 micrograms, but that's just enough to prevent a goiter, but not necessarily enough for optimal health or full body sufficiency. Comparatively, the Japanese diet, which is very rich in seafood and seaweed, provides up to 12 milligrams of iodine daily, contributing to their high life expectancy. So by now, with all this talk of excess caution about reactions and things like that, you might be thinking, whoa, there's no way I'm going to supplement iodine. But most people aren't going to have a problem with supplementing a normal rational dose. When supplementing iodine, consider starting with small amounts and gradually increasing your dose if necessary. Doses up to 1 gram are tolerated well by most people, but maybe you've already had an experience with iodine. If you've already reacted to it, supplementing first with selenium for a while before taking iodine can help prevent toxicity and autoimmune reactions in Hashimoto's and Graves' disease. One of the best known food sources of selenium is Brazil nuts. Just 2 Brazil nuts per day can supply almost 100 micrograms of selenium, which is sufficient. And if you're allergic to tree nuts, it's also in fish, chicken, and other foods, or you can just take selenomethionine supplement, which is an essential amino acid found in protein bound to the selenium. Makes a great delivery system. And selenium is a common deficiency for people with autoimmune thyroid conditions, as I said, can help prevent a toxicity of iodine. Iodine supplements come in several forms. There are liquid supplements, tablets, some that are protein bound, and others that are mineral salts. Clinically, I use mostly protein bound iodine supplements because since they're already bound to a protein, it's less like they'll glom on and attach to proteins in your body, in your mouth, in your digestive system, and create a problem there. 3 such protein-bound supplements, all from Standard Process, are Iodamir, which is a lower dose, better suited for maintenance at 200 micrograms, prolamine iodine, which is a 600 microgram tablet, and then prolamine iodine plus, which is a capsule at 3 grams. The plus version is really good for getting your low levels back to normal before switching to a maintenance dose. In any case, my purpose in this video, as I've said, is to raise awareness that iodine sufficiency is more rare than you might think, and it's worth striving for to prevent a ton of health problems. Remember, the information provided here is not a substitute for professional medical advice. Consult a nutritionist or healthcare professional before starting any new supplement regimen. But hopefully this has brought you enough information that you'll look into it further for yourself. And by understanding your iodine needs and getting to a level of whole body sufficiency, you can take a significant step towards better health and prevent many problems. Thank you for watching and taking the time to learn about this important topic. I would love it if you'd like and share this video and subscribe to the channel for more health tips. I'll see you soon.